Hi guys, this is Dr. Christopher James Macario, and this is an explainer video on diuretics. We will be discussing about diuretics, and probably we'll be able to discuss yung mga combinations niya with other drugs, specifically yung cardiac drugs natin. Okay, we will be discussing about that. Well, mm, as an objective, you are or you should be able to differentiate and understand the actions of the different diuretics and differentiate the side effects of the different diuretics. Now, pag sinabi kasi natin diuretics, it provides diuresis, meaning the passing of fluid, or in short, in Filipino, these are the medications that make the patient wee-wee. Okay? So, ayan. So, like I said, this is in combination with other drugs, like your cardiac drugs. Okay? Again, diuretics are used to decrease hypertension and edema. So, saan mo ba siya nakikita? Usually, itong hypertension and edema are found in those patients na merong kidney problem. Yeah, yung lalong-lalo na yung edema, hindi nila merong kidney injury. Hypertension, remember, we are talking about fluids. And like I said, this drug or these types of drugs are used in combination with your cardiac drugs, kasi yung cardiac drugs, if I may say so, is a combination of the three. Number one, those medications that target the heart or yung cardiovascular system. Number two, the ones that target the peripheries, yung mga dilators natin. And the other one, ito nga diuresis. I'm sorry, yeah, yung those that provide diuresis such as this, and we will be discussing that as we go along. And this type of medication produces increased urine flow by inhibiting sodium and water reabsorption from kidneys and tubules. So pag sinabi nating kidneys, we will be mostly talking about, or even yung diuretics, will be talking about yung significance ng sodium and ng potassium. So, like dun sa discussion ng chemistry or anatomy or whatever science subject you had prior to taking pharmacology. So, yung electrolyte plays an important role on the human body. Okay, so diuretics. So ano ba yung ginagawa ng diuretics? Number one, it lowers the blood pressure. So sabi ko nga sa inyo, this drug is used in combination with other drugs such as your cardiovascular drugs. It promotes diuresis fluid from the body and into the body, meaning it transfers those fluids found in the peripheries, yung nandun sa blood vessels natin, and it's the one that actually makes us pee. So it's the body and into the body. So yun yung diuresis, okay? It's the drug of choice for acute or worsening heart failures, or like I said, this drug is used in combination with cardiac drugs, and it's the first line drug treatment for reducing fluid volume. So pag sinabi nating fluid volume, it may come in different diseases, yung cardiovascular diseases or problems with the kidney. So para bumaba yung blood pressure niya, yung fluid nilalabas natin sa katawan. From the first statement, diuresis from the body and into the body. So basically, paulit-ulit lang siya. Nilalabas natin yung fluid. Saan galing yung fluid? Of course, with the food we eat and the things we drink, like water or juice or whatever. Okay? And it is an inotropic drug, meaning yung ginagawa niya sa heart is it lessens the force of the heart, or in short, it relaxes the heart kasi yung fluid dun sa blood vessels nawawala. Okay? Nawawala, or hindi man nawawala, but nababawasan. Okay? It is frequently described with digoxin or other agents, like I said, it is in combination with other drugs, cardiovascular drugs, to maximize its effectivity. So, yung digoxin is a type of drug, okay? However, itong digoxin na to na gamot is a toxic, okay? Which we will be talking about when we get to cardiovascular drugs. Diuretics are used to decrease hypertension and edema. Parang naulit lang kanina. But uulitin na lang ni Sir, dun sa mga matatanda, di ba, nakikita natin may mga namamanas, etc. Those are probably signs of kidney problem. Okay, wherein nare-retain yung mga electrolytes. And this type of medication produces increased urine flow. So, diuretics, remember DDD, it decreases the blood pressure, drains fluid, and dehydrates or dries up the body. Okay, so D. Let's talk about the first type of those diuretics. So, pag sinabi nating diuretics, it ends in "ide". Okay? Example, furosemide or hydrochlorothiazide. It rhymes with dried. Pero hindi sorbide because it is a cardiac drug. So, ngayon pa lang, sinasabi ko na yung mga diuretics ends in "ide", like furosemide, hydrothiazide, or hydrochlorothiazide, but not isosorbide. It There are two types of diuretics. On your left, you will see that it is your potassium wasting drugs from the word itself. Potassium wasting drugs, meaning it takes out those potassium outside of the body, and these are your thiazide and your thiazide like diuretics. Pumapasok din dyan yung loop diuretics. It provides osmosis. We also have your carbonic anhydrase inhibitor. And remember, these types of drugs, yung potassium wasting diuretics, is only given if potassium is normal. Ano ba yung normal na potassium? The normal potassium level is 3.5 to 5. So if it's not normal, nakita mo dun sa lab ng patient na meron siyang 3.4, okay? So do not give this drug. So meron siyang hypokalemia kasi ano siya, potassium wasting diuretics. And you know, the importance of potassium, ang dami niyan. Okay? Isa na dito yung sa nervous system. Okay? The firing of the nervous system. And of course, we encourage our patient to eat food high in potassium, and those examples are your green and leafy veggies, melons, liver, and banana. The other type of diuretic is your potassium sparing diuretic, which acts primarily in collecting renal tubules and late distal tubules to promote sodium and water excretion and potassium retention. An example of which is your spironolactone. Think S or spares potassium. So, yung difference ng dalawa is the first one is a one that wastes potassium while the latter spares your potassium. Okay? So, ito yung dalawang types ng diuretics. Okay. Let's talk about thiazide and thiazide-like diuretics. Thiazides act on the distal convoluted tubule beyond the loop of Henle to promote sodium, chloride, and water excretion. So aside from your potassium, so it also takes out your sodium, chloride, and water. It promotes calcium reabsorption. An example of which or yung palaging ginagamit dito sa thiazide and thiazide-like diuretics is your hydrochlorothiazide. Potassium supplements are frequently needed when using these drugs. Bakit? Kasi nga, when these drugs are used continuously, we continuously waste diuretics. And as medical professionals, whenever you are a doctor or a nurse, tinitignan mo yung laboratories ng patients natin. Okay? the fact that we are giving potassium wasting diuretics, kailangan bantayan din natin yung laboratory. Kailangan bantayan natin yung potassium specifically. Kasi alam natin na nagwa-waste nga ng diuretics. Ng potassium, itong diuretics na to. Remember, the normal value for your potassium is 3.5 to 5. And so, anything that is below normal in relation to this drug should be reported to the doctor. Okay? So, we have to watch out for, number one, worsening crackles. Okay? Bakit kailangan nating, why do we need to watch out for those worsening crackles? Bakit? Kasi nga, meaning it is accumulating fluid. Okay? New edema on the legs. So, pag sinabi nating edema and crackles, it means there is an increased fluid in the body. Ano pa, yung dapat na we should watch out for, weight gain. Okay, itong tatlo na to, worsening crackles, edema on the legs, and weight gain are signs that fluid is accumulating in the body. Okay? So, for people na merong heart problem, this is a very serious problem kasi nga nahihirapan yung heart. The more na may fluid, mas nahihirapan yung heart na mag-pump to and from. Okay? The side effects of your potassium wasting diuretics is that there is an electrolyte imbalance. Okay. So ano daw to? You have your hypokalemia, meaning there is low in uh, calcium. I'm sorry, hypercalcemia, meaning there is an increased calcium. Hypokalemia, meaning masyadong mababa yung potassium, which is sometimes normal, but we have to report it kasi pag sinabi nating kalemia, mababa yung potassium, and you have your hyperglycemia. So, ano ba hyperglycemia? Pag sinabi nating hyperglycemia, meaning yung sugar mataas. Okay? Now, we can all go, itong mga side effects na to goes back to the things that your thiazides do. Ano ba yung ginagawa kasi na to? Remember, it promote sodium and chloride and water excretion. Natural, yung kapag kumonti na kumonti yung mga electrolyte na yan, natural, magkakaroon ng problems, and that is why we have to watch out for those drop in those electrolytes. Okay? So remember, less sodium retained is equivalent to less swelling retained. Okay, let's talk about the second diuretic or potassium wasting diuretic, which is your loop diuretic. Now, this type of diuretic acts on the thick ascending loop of phenyl to inhibit chloride transport of sodium into the circulation and inhibit the passive reabsorption of sodium. So, meaning sodium and water are lost, including potassium, magnesium, and calcium. And just for you to remember, it's the number one drug for worsening heart failure. And that drug is your furosemide. Lagi mo to makikita sa word, furosemide. Okay? So, side effects of your loop diuretics are, well, fluid and electrolyte imbalance, like your hypokalemia, hypocalcemia, hyponatremia, and hypocalcemia. Parang naulit yun Okay. So, hypokalemia, ano ibig sabihin yan? Meaning, mababa yung potassium niya. Okay? What's the normal potassium? It's 3.5 to 5.0. So, ano pa? Hyponatremia. So, pag sinabi nating hyponatremia, it means that the level of sodium in the body is low. Okay? And of course, you have your hypocalcemia, meaning mababa yung calcium. So, these are the electrolyte. Kasi yung electrolyte is essential for the functions of or how the body functions. So, importante sila. Like I said, yung human body, ayaw niya ng konti, ayaw niya ng marami. Gusto niya in between. Okay, that's what you call homeostasis. Now, the physiologic changes associated with your loop diuretics include hypotension. Bakit magkakaroon ng hypotension? Nagkakaroon ng hypotension kasi nga yung it promotes diuresis, and pag lumalabas yung fluid, of course, yung blood vessels natin, okay, kumukonti yung resistance ngayon dun sa blood vessels natin, and hence yung byproduct is your hypotension. Now, remember, this loop diuretics is ototoxic, or meaning it has this ototoxicity effect, meaning it's toxic to your ears. Okay, meaning yung sa pandinig mo. Skin disturbances, you also have photosensitivity, and you have your hypovolemia. Okay? So, pag-usapan muna natin yung furosemide. If your furosemide is given too fast, it causes the following. So, yung ringing of ears, okay? Ang tawag doon tinnitus, but for furosemide, doon natin nalalaman na ototoxic na pala yung binibigay natin, or nagiging toxic na yung furosemide. Okay? So, pagka yung furosemide, sinabi sa'yo ng patient, nagbigay ka ng furosemide, tapos sinabi sa'yo ng patient mo, parang merong nagri-ring sa tenga ko. Okay? Meaning, masyado nating naibigay ng mabilis yung furosemide, or ototoxic. Hypotension, pag masyado natin binigay yung furosemide ng masyadong mabilis, automatically, syempre, yung ginagawa kasi nitong mga diuretics na to is promote diuresis, meaning yung fluid from the peripheries, nilalabas niya. And so, the byproduct of that is, of course, ang gusto nga natin is bumaba yung blood pressure. So, sometimes, masyadong marami tayo na ibibigay that it causes hypotension. Okay? Sabi ko nga sa inyo, this is used in combination with your cardiovascular drugs. Okay? And one of which the effect, yung gusto nating makita talaga is yung bumaba yung blood pressure. However, pag masyado naman mababa yung blood pressure, okay, ayaw naman din natin yon, kasi nagiging yung patient experiences lightheadedness, lalong-lalo na yung kunyari, masyadong mabilis yung pag ano ng blood pressure niya, nahihilo yan. So, we have to be aware, kasi baka malaglag sila sa kama or what. Okay? Can cause the following if given too much or given long term. We expect na kapag ka ganyan, pag hindi natin minonitor, okay, nagkakaroon ng sinasabi nating nephrotoxicity. Nephro meaning yung kidneys natin, and toxic meaning, well, toxic, masama. Okay? So, ano daw ibig sabihin yan? Whether it's kidney damage. So, pagka nephrotoxic na or nagkakaroon na ng nephrotoxicity, we have to check two things. Number one, pag nakikita natin mataas yung BUN and yung creatinine. Okay? So, when there is kidney damage, usually yun ang dalawang tinitignan natin. Yung BUN or yung creatinine. And of course, yung sinasabi nating hypokalemia or low potassium. Okay? So, furosemide. Okay. The next one is your osmotic diuretic. So, what it does is it increases the osmolality and sodium reabsorption in the proximal tubule in the loop of Henle. So, their sodium, chloride, potassium, and water are excreted. No wonder kapag itong mga gamot na to yung binibigay natin sa patient, there would always be fluid and electrolyte imbalance. Lalong-lalo na when those electrolytes such as sodium and calcium are excreted from the body. Okay? So, just to give you an overview, pag pinag-usapan natin yung diuretics, we always talk about the urinary system, specifically the kidneys and yung nephrons. You know what's nice to know about the urinary system is that uh, i- sabi nila excretory system daw yon. But ako personally, yung opinion ko rito, hindi siya excretory system. Although yun talaga yung ginagawa niya. But parang sa akin, it's a saving system. Bakit nasabi ni sir na it's a saving system? Kasi for example, you drank 1 liter of water, would you believe that your kidneys save 90% of those fluids while only excreting 10%? Diba? So that's what your kidney does. Kaya minsan mapapaisip ka, excretory system, but hey, yung purpose niya nga is to excrete. Okay? Okay. So, the frequent drug you see when you talk about osmotic diuretic would be mannitol. So it is frequently prescribed and that promotes diuresis in 1 to 3 hours after IV administration. Ito yung mannitol for me dapat pag binibigay mo to minsan dapat talagang bantay sarado mo yung patient. Why? Kasi nga it usually affects the patient on a fast pace kasi nga through IV. Now, remember, itong mga gamot na to, yung mga diuretics, kahit na ano pang diuretics yan, binabantayan natin yung patient natin kasi nga bumababa bigla yung blood pressure. Meaning, nagkakaroon sila ng hypotension. Now, 'di ba gusto naman talaga natin yun sometimes lalong-lalo na for those patients who have problems with yung heart problems to relax the heart. 'Di ba? Gusto naman talaga natin bumaba yung fluid level niya, bumaba yung mataas na blood pressure niya. However, when you think about the decrease in blood pressure, iniisip natin palagi yung airplane or it can be compared to an airplane or aeroplano. Why? 'Di ba pagka sumasakay ka sa eroplano, ayaw mo yung parang mabilis bumaba, natatakot ka, right? Well, that also goes or is also true for the human body. Kasi kapag masyadong mabilis yung pagbaba ng blood pressure, okay, nahihilo yung patient. Remember, yung mga terminologies or side effects na hypotension automatically would put the patient at risk for fall. Pagka nalaglag yan, kasalanan mo yun. Right? Malay mo, mabagok yung ulo niya, which is we do not want to do. And that is why we have to keep in mind na binabantayan na itong mga gamot na to, lalong-lalo na itong mannitol. Kasi mabilis siya mag-take effect. Remember, promotes diuresis in 1 to 3 hours after IV administration. And no wonder, yung mga side effects niya, fluid and electrolyte imbalance. Kasi nga, ang dami niyang tinatanggal na mga electrolytes. Nausea and vomiting. Tachycardia from rapid fluid loss. Remember, pagka konti lang yung fluid, nare-relax yung heart. So, medyo napapabilis. Nakakaroon ng tachycardia. And of course, acidosis. The next one, or number 4, is your carbonic anhydrase inhibitor. So, what does it do? What you can see, nandyan si Captain America, may shield. Actually, yung shield lang yun nasa isip ko. What does it do? It blocks carbonic anhydrase, which causes increase in sodium, potassium, and bicarbonate excretion. So, what does it do? Well, primarily, it's used to decrease IOP in patients with glaucoma. Ano yun, IOP? Intraocular pressure in patients with glaucoma. So, an example of those carbonic anhydrase inhibitors are your acetazolamide and your methazolamide. Okay, uh, we move on to the next type of diuretics, which is your potassium sparing diuretics. So, from the word itself, sparing potassium. Okay, so kung kanina, yung first one, wasting potassium, ito naman, opposite. Okay, so it acts primarily in collecting renal tubules and late distal tubules to promote sodium and water excretion and potassium retention. So at this point, inire-retain natin yung potassium. An example of which is your spironolactone. Think S or spares potassium. Blocks aldosterone but keeps potassium. Okay? Just like your lisinopril, yung ACE inhibitor, losartan, ang ibig sabihin niyan is ARBs. Itong dalawang to, yung ACE and ARBs, okay, those are cardiac drugs which we will be discussing next. And spironolactone, which is your diuretics, spares your potassium. So, kung mapapansin mo, yung mga cardiac drugs such as your ACE, your ARBs, and your diuretics, meron silang pagkakapare-pareho. What is that? It spares yung potassium in the body. Okay? So, like I said, yung mga gamot na to, yung mga cardiac drugs and yung diuretics are used in combination. Okay? So, ano pa? What should we do? We should teach patient to avoid foods or food rich in potassium. So, ano ba yung mga matataas sa potassium? Alam na natin kanina. Green leafy vegetables. Okay? Ganyan. Any potassium abnormality, place the patient in cardiac monitor as priority intervention. So, sabi ko nga sa inyo, itong mga gamot na to, yung diuretics is used in combination with your cardiac drug. So, may sakit talaga pagka meron na to. Potassium pumps muscles. Potassium pumps muscles. Any problems with muscles like muscle spasm or cramps indicate a potassium problem, weakness, or paresthesia. So, pagka muscle problem siya, automatic potassium problem. Okay? So, why is that important? Because one of the things that pumps keeps you alive 24/7 since nung pinanganak ka hanggang sa mamamatay ka, okay, relies on this heavily kasi nga muscle siya. Okay, lahat ng muscle relies heavily on those, yung sodium, potassium, and calcium. But specifically, this, yung sinasabi natin na potassium-sparing diuretics is given for a reason. But just as to act as a guide, remember, low potassium means low pumps in the heart. Meaning, pag konti yung potassium mo, mas mabagal yung tibok ng puso or the heartbeat. Meaning, mas konti yung pulse rate. Okay? Okay, other considerations pag pinag-uusapan natin yung potassium. Caution in giving potassium. So, meaning do not kill your patients. Now, ngayon, kung ikaw ay naglalaro ng Mobile Legends, okay, or ML, kilala mo yung nandyan sa picture. Okay, he is an assassin. So, ito pahabol lang kasi nga 'di ba merong two types ng diuretics. We have your potassium wasting and potassium sparing. So, yung isa nag-waste ng potassium, yung isa nagsisave ng potassium. And kung nakikita mo dito, nagbibigay tayo ng potassium. This is in lieu, for example, merong hypo or so mababa yung potassium. Okay? So, we never push potassium via IV. This means instant death to the patient. So, palagi natin siyang binibigay ng piggyback. Okay? Or naka-side drip dun sa patient. But never binibigay ng IV push. It's like a lethal injection. Automatic mamamatay yung patient mo. Magka-cardiac arrest, tapos mamamatay. Okay? Potassium is always given via IV bag from 1 hour to 4 hours or more and never 30 minutes or 45 minutes. Okay? Remember BBP. Blood pressure. Check BP before giving diuretics. Saying, okay? So, yung systole should be 100. B for BUN and creatinine, check the labs or the kidney labs. Always check the labs because it may hurt kidney before giving. And for P, there are potassium imbalances. Always put patient in cardiac monitor and watch out for muscle spasm, cramps, weaknesses, or paresthesia. So, remember, pag ang pinag-uusapan natin is potassium or diuretics, etc. Pagka may mga signs and symptoms pertaining to muscles, cramps, etc., yung mga ganyan, those certainly mean potassium imbalance. So, check the labs. Okay? Okay, and a gentle reminder when you talk about diuretics, when you review about diuretics, and when giving diuretics in general, diuretics are given in the morning, not at night. Why? Kasi yung mga diuretics from the word itself, 'di ba? It promotes diuresis. Now, kung ikaw yung nurse, okay, at ibibigay mo sa gabi, tayo ng tayo yung patient mo. And you will be bothered. Bakit? Kasi mo-monitor mo siya eh. Remember, yung diuretics, we need to watch out for yung sinasabi nating hypotension. Okay? Diuretic makes patients dizzy. So advise your patient on slow position changes to avoid fainting and fall. Why? Ang tawag doon, hypotension effect. Remember yung sinabi kanina natin na yung gusto natin, yung effect ng pagbaba ng blood pressure parang airplane. So, dahan-dahan lang pag naglalanding from nandun sa mataas, papunta doon sa baba, dahan-dahan lang. Kasi nga, nahihilo sila. Okay, yun yung sinasabi natin, hypotension effect. Okay, pag masyadong mabilis bumaba yung BP. Okay, so, advise our patients on slow position change, lalong-lalo na kapag kakabibigay lang ng diuretics. Okay? Sabihin natin sa mga patients natin na nanay or kuya, tatay, pagka po kunyari gagalaw kayo sa kama, dahan-dahan lang po kasi baka malaglag kayo. Yung gamot na ibinigay po namin sa inyo, baka masyado pong bumaba yung blood pressure ninyo. Baka biglang himatayin kayo. So, at least safe po tayo. Okay? Ano pa? Daily weighing. Okay? So, report 2 to 3 pounds gain. Why? Ano ibig sabihin yan? Weight gain means water gain. And remember, ito nga, di ba, ginagamit nga natin tong diuretics in combination with cardiac drugs. And bearing in mind na yung diuretics, ang gusto natin is magkaroon ng diuresis, meaning yung fluid lumabas. And if the patient gains weight, ang ibig sabihin, may na-retain na water. Okay? Ano pa? Sunburn. Pagka nagbibigay kasi tayo ng diuretics minsan, okay, so nagkakaroon ng diuresis, very sensitive yung balat natin. Okay, lalong-lalo na kapag lumalabas ka sa araw, so madali silang ma-sunburn. Kasi syempre, yung fluid lumalabas nga. Ano pa? Low sodium diet. Ano ibig sabihin yan? Why do we need to do that? Okay, remember the saying, wherever sodium goes, water follows. And that is true. Pinalalabas nga natin yung fluid. Pagkatapos ang kinakain naman niya, mataas yung sodium content, yung mga salty food. So what does it mean? Yung nilabas mo, binalik mo din. Kasi nga, tumataas yung sodium sa katawan eh. So advise them na iwasan yung mga salty food. Okay? Avoid OTC medications like your cough and flu medicine, antacid, your acetaminophen like Tylenol, your NSAIDs like your ibuprofen and your naproxen or your naproxen sodium. Why? Because all those OTC medications contain high amounts of sodium. Okay? So I hope you learned something from this explainer video, and thank you for listening.